Hi there, we're back again for one of our questions with a dermatologist. And what we've done is the Empathy for Itch team has done a survey of veterinarians across Canada, wondering what the most common questions are that they get from their pet owners about dermatology. So I'm Dr. Juanita Glencrofts, and I work with Royal Canin, and I'm part of the Empathy for Itch team. And Dr. O'Shaughnessy Hunter, would you like to introduce yourself?
Yeah, sure. I'm Dr. Laura O'Shaughnessy Hunter. I'm a veterinary dermatology specialist in Morriston, Ontario.
All right. So do you want to know what your question is for today?
Yeah, let's go.
All right. So your question today is, what is atopic dermatitis, and will my pet need to stay on these medications for the rest of their life?
Yeah, that's a great question. So atopic dermatitis is basically the medical term for itchy, inflamed skin secondary to environmental allergies. People most commonly will experience their allergies through sneezing, runny eyes, runny nose, but dogs and cats primarily experience their allergies with itchy, irritated skin and ears. And then in terms of the second part of the question, will my pet be on these medications for the rest of their life? So unfortunately, with environmental allergies, we can't cure them. They will be around lifelong, but there's lots we can do to manage them. And in the last 10 years or so, lots of new medications have come out, which are really effective and very safe, which is fantastic. All these medications that we have, they tackle the symptoms of allergies. So reducing itch for itchy patients, redness and inflamed skin, but they don't actually.
A Band-Aid.
They're a Band-Aid, yep, very effective Band-Aid in many cases and work really well. But when we stop giving those medications, the allergies are still there. So the symptoms are going to come back. Now, there is one treatment option out there that can be considered to potentially get to a point where your pet will need less pills, or in some lucky patients, none at all, which is if we did environmental allergy testing and immunotherapy, which are basically allergy shots. And what those entail is first performing an environmental allergy test where we figure out exactly what your pet is allergic to, either through a skin test or a blood test or a combination of both of those. And then from that information, I can formulate a specific immunotherapy, which contains many doses of the things that your pet is allergic to try to desensitize them to them. So we're presenting these allergens to the immune system in a different way to try to make it more tolerant of these allergens and essentially less allergic.
So this would be what people would consider allergy shots, right?
Exactly. It's exactly the same as what people get for allergy shots. And then so we're trying to kind of get to a point where we maybe don't need as much of these other pills that many of them are on to treat their symptoms. Now, if they are effective, then we generally do keep those going lifelong. So either which way you look at it, the treatment for environmental allergies is a lifelong treatment plan. But there's lots and lots we can do. Many of them are very safe and very effective to make sure that your pet leads a very comfortable and healthy and long life. And the best person to discuss this with is your veterinarian or possibly a veterinary dermatologist.
So can I ask one more question? So
absolutely.
This then would be, depending on what your pet is allergic to, the treatment may be more frequent or less frequent. So like if they're allergic to something in my house, like dust mites, they probably need treatment year round. But if they're only allergic to, say, ragweed, is it possible that I might only have to sort of scale up in and around the ragweed season and then come back down at another point?
Yeah, absolutely. So certainly we have some of our pets that are very seasonally symptomatic. So they're only itchy at certain times of the year. So they're only going to need their medication at that time of the year. And then other ones that are allergic to exactly dust mites is a really common one that will be allergic all year round and require medication and treatment all year round.
This is great information, Dr. O'Shaughnessy Hunter. Thank you so much for answering one of these questions for us. And hopefully we'll get an opportunity to do another one with you someday.
Absolutely. Thank you very much.
All right.
Bye-bye.
Have a great day. Bye-bye.
Bye.